Welcome. My guest is Dr. Mark Lachs. His book is Treat Me, Not My Age. It's been described as a doctor's guide to getting the best care as you or a loved one gets older. Dr. Lachs is the director of Cornell Center for Aging Research and Clinical Care. He's the director of geriatrics for the New York Presbyterian Healthcare System, chief of the Division of Geriatrics and Gerontology at Weill Medical College, and if that's not enough, the Irene F. and I. Roy Sadie Distinguished Professor of Clinical Medicine. Dr. Lachs, are you sure you have time for this interview?
I have plenty of time for the interview, and you did not mangle one of those titles, Scott, so thanks for having me.
It's my pleasure. Your book has been written up in several different places here, and I happened to catch the article in the New York Times as part of a piece called What to Do Now to Feel Better at 100. So I guess what we're saying here is that people are living a little bit longer, and some preparation has to be done to make sure that those later years are of good quality.
That's exactly right, Scott. The goal is not necessarily to add years to life, but to add life to years. Because as you know, you've seen one 80-year-old, you've seen one 80-year-old, right? I have patients who are going to work every day as they did in their 40s and 50s, and I have others who are homebound. And it's the small tweaks we make in our 40s, 50s, and 60s that really determines what you'll look like at 80, 90, or beyond. And sure, it's genetics to some point, but we're learning that genetics is a much smaller component of that, Scott.
One of the things that you describe here in your book is called physiological reserve. Can you talk about that?
Yeah, so when we're born, Scott, we're given far too many nerve cells, muscle cells, brain cells, and those generally, over the course of a normal lifetime, decline rather slowly after the age of 20, different rates in different people and in different organ systems. And, 1,000 years ago, when life expectancy was 20 or 30, we never needed that physiologic reserve, that extra power. So, over the course of a normal 80 or 90-year lifespan, Scott, you can lose a significant amount of muscular strength. And unless you're a pitcher for the New York Yankees where they time your fastball every spring to see if your contract will be renewed, you generally don't realize that you're losing some muscular strength. But at some point in your 80s or 90s, that muscular loss can result in the inability to get out of a chair or to get in and out of the shower. But if you preserve muscular strength, that physiologic reserve, you can in fact make sure that your last years are spent actually, dancing, walking, playing tennis, as opposed to being essentially immobile. So the decision to be a couch potato in your 40s or 50s versus taking an active, aggressive role with walking and staying mobile. And again, you don't have to drop 6 dress sizes overnight. That seems to be the American way these days. Small increments in mobility really make a huge amount of difference when started relatively young.
Is it always better to start younger, or could somebody in their 60s watching this video go, you know what, I could probably start doing that right now? Is that too late?
It is never too late. In fact, the article describes a bunch of older adults in their 80s on average who actually fractured their hips. So these are individuals within whom frailty had already begun. And they had these individuals do a bit of high-intensity weight training with very low-level weights, but lots of repetitions. And with these modest interventions, gait speed improved, falling decreased. I tell patients it's a little bit like seeing an iceberg off in the distance. If you make a 1 or 2% course correction, even if it's a year or 2 or 3 away, you can really avoid the iceberg altogether.
You also talk about a supportive environment, and I think that can include a lot of different things, but making things around your environment easy for you to use, probably continuing your network of friends and just being overall active and engaged.
Oh, yeah. I mean, we talk about a nest egg in a financial sense, growing the nest egg, having enough to live after retirement, after you have some critical mass of assets. But that notion of retirement is too limited, Scott. We should really be thinking about a nest egg that includes a large and robust social network. There are gajillions of studies now that show that two individuals with the same disease or undergoing the same medical procedure, one with a robust social network, one with a very limited social network, the medical outcomes are much better in those individuals with a robust social network. And the environment also includes your home. Jane Brody, in her Times article, touched on many of the very simple home modifications one can make. Again, they should start in your 40s, 50s, and 60s to make sure that your home is not making you seem sick as you get older. I tell my patients, it's not just radon and mold. Our homes were designed for people in their 20s and 30s. You may have moved into a home as a newlywed, and now 20 or 30 years later, you're having trouble reading recipe labels, reaching shelves. I just turned 50, and I have trouble reading recipe labels now. Now, if those were printed in a font, Scott, they were for 50-year-olds, and why not? That's as an arbitrary an age as a 25-year-old. It would not occur to me that I might have a visual disability, right? So it's a way in which the environment makes us seem impaired when, in fact, we are not.
He is Dr. Mark Lachs. The title of his book is Treat Me, Not My Age. Dr. Lachs, it's a pleasure. Thanks for talking with us.
It's great to have spoken with you, Scott. Have a great day.
And thanks for watching.